Warning that came out from the American Heart Association this week, and a lot of people are now confused. What it said was that women are actually at higher risk of having a stroke than men. So, Dr. Siegel, why would that be true? And is it?
I want women out there to listen carefully to this. This is extremely important. It's the American Heart Association and the American Stroke Association. And the reason is that women get strokes. More than 50% of people who get strokes are women. More women get them than men. And it's the number 3 cause of death among women, number 4 cause among men. So why women? It's specific reasons, Jamie. Women, when they're pregnant, are at higher risks of stroke, especially if they have high blood pressure, a condition called preeclampsia, which is high blood pressure and protein in your urine. That increases your risk. If you're on birth control pills, it increases your risk. I say to everyone, if you're going to go on birth control pills, get your blood pressure checked first, because blood pressure and birth control, bad combination. If you have high blood pressure and you're on birth control pills, your risks are up. Smoking increases the risks across the board. So if women are on birth control pills and they're smoking, their risks of stroke go up. If they're pregnant and smoking, their risks go up. Now, here's one I really want people to know, and I'm not trying to scare people. I'm trying to inform people on this. Migraine headaches, very, 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 very common in women, 4 times more than men. If you have migraines and you smoke, your risk of stroke goes up. All of these things, they're subcategories, but all of these things add up to women being at higher risk. So I say, exercise more, eat fruit and vegetables, don't smoke, cut down on alcohol.
What's new about this warning, though, Dr. Smarty? Because they've always said that people who have migraines, particularly women, are more at risk for stroke. And if you're smoking and you're pregnant, change the channel, because there's no hope for you.
Well, we don't want people to change the channel. They love this, and they keep coming in from every angle. Look, the truth is that so far, everything we've spoken about in the past has been high blood pressure, cholesterol, and has been also diabetes. Those were the risk factors. So going back to your question is, what's new about this is there's some association, Jamie, between migraine and people who have migraine and aura and the visual and ringing in the ears, etc., with stroke. This is something new. They also want you to know that if you're going to become pregnant, make sure you check your blood pressure, because once you're in the pregnancy and you have preeclampsia, it's maybe too late, because it's hard to start the medications as a result of the childbirth. So, you know, this goes on, and 137,000 women and men are dying from stroke. It's a serious problem, and we want to make sure that we prevent this. If you're a smoker, if you're on birth control, please, these are risk factors, because it increases the blood clots. Women in general.
We still don't have the answer from you both about why women are more at risk. So is it they don't recognize the symptoms?
No. There is a physiologic difference between women and men. We think that there are some endothelial disorders in the vessels that, as a result of hormonal changes, whether it's birth control pills, whether it's smoking and all these other risks, that can change that. Stress can do this. Depression can do this. And migraine. Cellular changes that can cause this. What I want people to know out there is, if somebody is having a stroke right in front of you, you need to know about this mnemonic fast that we've spoken about. The facial drooping, the asymmetric arms, arm weakness, you know, slurry speech, and time is of an essence, because time loss is brain loss.
Well, there's also the ability to go to the hospital and get not an antidote for a stroke, but time matters, because they can reverse some of the symptoms. But what about hormone replacement therapy then? Should thank you, doctor. Should we reconsider women of a certain age to do that? Because if you change the hormonal structure, you could put yourself more at risk or less.
Dr. Colby, that's an excellent point, and I think that the hormonal shifts are the issue. That's why there's an increased risk of birth control pills. There's an increased risk with hormone replacement therapy. Listen, as women get older, there's also a risk of atrial fibrillation over the age of 75, which is an arrhythmia, and higher cholesterol. Women are living longer. That's another reason. And the most important thing of all is we're not looking for it enough. Today, we're going to get women to look for it more. Women can have more subtle signs of stroke. David gave out fast the symptoms of stroke. You know, your arm gets weak, you're slurring your speech. With women, it can be more subtle, and that's another thing. Women, be on the lookout for these symptoms.
Does baby aspirin help?
Yes, but it's not for everyone, but yes.
They're basically saying that if your blood pressure is over 150 over 100, then you should start taking aspirin or maybe even calcium pills. If you have severe blood pressure before you get pregnant, you want to make sure you check that. If you have migraine with aura, stop smoking. And also, exactly as Mark mentioned, if you're over 75, women over 75 need to look for atrial fibrillation, which is this irregular heartbeat. And those are the risk factors, and that's a new guideline.
One final point. This is important. American Academy of Obstetrics and Gynecology is too lax on what they make women do for pregnancy. They let you go into pregnancy with too high a blood pressure. I'm saying today, lower your guidelines. They say 150 over 100. I say lower. I want women to have controlled blood pressure when they're pregnant.
All right, well,